I would now like to turn the floor back to our colleagues in Brasilia for the official launch of the Brazilian Consensus Framework for Ethical Collaboration. It is an honor for me to introduce Eduardo Winston, President of the Board of Directors of the Health Ethics Institute in Brazil. Eduardo, the floor is yours.
Bom dia a todos. Bom dia a todos.
Good morning, everyone. I would like to thank everyone, thank the health minister and all the entities that are here. And I would like to thank everyone for everything that they're doing for the health in Brazil. Really thank you for the Health Institute. The Health Ethic Institute is very important. It's a very participative institution that has as a goal specifically to be able to get that ethic competition, which is very good for the health sector. So I would like to thank Secretary Marcelo Guarani, because it was very important what he said, especially on the health part. This is only going to be possible if all the agents recognize what we are doing with this ethical collaboration. Let's just talk about a hypothetical situation when we imagine two societies with the same structure, with the same technical capability, same professional capability. And one of these societies has ethics, and the other one doesn't, has this consensus. Certainly, the first society which is guided by ethics and integrity is going to have more resources to be able to have these, good ethics, and the other will have more challenges with monitoring and understanding the prices and the collaboration. So the Institute of Health, thank you so much for everything that you're doing here. So here we have over 30% of resources that should be given to health promotion are now being sent over to admin activities, exactly because of this low trust that still exists in our country. But it's very good to see this, and it brings a lot of hope to our sector. And this real landmark of this process for health. For this landmark to be effective, we need to have a lot of, help from other agents. We need to focus on our activities and all the processes that we have been proposing here that are a part of our reality. So we want to be a reference. We want to improve our delivery even more for our population, improving our way of acting and our work. And we all have great responsibility once again. We have really great responsibility, which is not financing the entire chain. So it is a great pleasure. And right now, I would like to move over to Dr. Marcelo Queiroga, and I would like to tell him give him a copy of our consensus framework and now go over to him. Thank you so much. Good morning, everyone. I would like to initially say thank you to Dr. Socorro Gross, representative for PAHO WHO in Brazil, Marcelo Guaranis as well, who is the secretary for the Ministry of Economy, Carlos Gouveia, Brazilian Chamber of Laboratory Diagnosis, Health Ethics Institute, Bruno Bezerra, Executive Director for ABRAIDE, President for ABIS, Don Graves, Deputy Secretary of Commerce, United States, and finally, Scott Whitaker, President and Chief Executive Officer for Advanced Medical Technology Association, ADVAMED. And we're very happy here because I was a part of this at the beginning, because we had this initiative and the integrity and good practices in the health system. And I will know the truth, and the truth will set you free. John. And we said, nothing makes me more proud than the sun shining over me. Paulo Guedes. Brazil has industry pirates and swamp creatures that destroy the economy of our country. And I want to say, and also public health. And all of us are gathered here to try to avoid this happening. The Brazilian state from 1958, with the Citizen Constitution, instituted the dignity of the human person as a base principle of our society. So, health is a fundamental right, and all of us know that health is everyone's right, and it is the state's duty to provide it. Medicine, I say medicine because it is the oldest health profession, they are confused with ethics. The father of medicine is also the author of the first ethical diploma that we know of in the history of health, in the history of humanity, I should say. So the one who really carved principles such as no evil, primo monocelli, the principle of beneficence, integrity, autonomy, relationship between doctor and patient. And lastly, with justice, not justice in courts, but the justice of principle. This principle is so important at the moment when we have vaccines and very precious materials that are hoped to be able to finish the pandemic character of this disease, COVID-19. So these are very clear reasons for us to be able to choose more ethics, more integrity, not only in health, but in society as a whole. And in Brazilian's health system, our unique health system presented by supplementary health, and it represents around 10% of the health in this country.
Within the pandemic and the increased awareness about the importance of the health system, it is important that we are able to improve access to health, public and supplementary health, because it's not because it's a supplementary health that we should have less access than public health. And we have to pay attention to these matters so that we have autonomy to produce pharmaceutical inputs important for the production of vaccines and so forth and so on. So it's essential that we have a commitment such as this framework. And that means not just writing the document, but really being able to change our behavior. We have one of the most complex legislations regarding corruption, but a TV show promoted the disruption of this practice. When we watched what we already knew for long, but did nothing up to that point. So based on these rules, based on reports, we will be able then to change this environment and grow our health system. This is a problem of the society, and it's difficult to deal with the conflicts of interest that we have today. Today, the progress of science poses a lot of challenges. We have medications, for example, for rare diseases, genome therapies, and one patient's treatment sometimes is more expensive than the whole budget of a health system in a city. And that poses a challenge for public agents in Brazil. Brazil has one of the greatest public health care systems in the world. And with that, we have the challenge to provide at the largest extent possible and so we have to provide healthcare of quality. So we cannot accept the stimulation of a practice against the Brazilian government. Today, we've been watching that repeatedly. And that is carried through bills in the regulatory aspect, when Brazil has one of the most advanced sanitary regulations in the world. I would like to emphasize as well the sovereignty of technical decisions. In that matter, the law of 2018 created the Permanent Commission of the Health Ministry to have specialists working on technical evaluations so that technologies are entered in the health system. So the evaluation of scientific evidences and its impact on the health system in order to evaluate if that public policy will provide benefits or not for the public healthcare system in Brazil. We have been working with the strengthening of the healthcare system. With that, we are able to include more technologies that are offered. So it is important that the Institute Ethics in Health helps us to maintain the sovereignty of administrative decisions that encourages its participants to comply with the technical decisions that are made. Right now, we have seen the approval of a bill that passed through the Congress for supplementary health without evaluation. And that damages the technological
até que um estudo de fase 2 foi liberado pela agência regulatória que não tem, no caso a Anvisa, que não tem essa finalidade de fazer esse tipo de avaliação. Então, entendo que devemos estar atentos para todos esses...
I understand that considering all these aspects, we have ethics matters and other hidden matters. We have to find out the interest of these agents that defend some sort of behavior that sometimes under the sheets carry a myriad of interests that which are not the interests of the Brazilian society. I'm sorry, we're having technical issues with the audio and it's really difficult to understand right now. We will do our best to continue translating the Ministry of Health of Brazil. So we want to create a stronger healthcare system that will serve and abide by our Constitution. Considering the COVID-19 pandemic, since March 2020, we've been dealing with that, with over 500,000 deaths in Brazil. Socorro also mentioned the issue of vaccines and the amount of vaccination that we've been able to carry out. Over 60% of our adult population has received the first dose. We have 160 million Brazilians over 18 years old. Right now, we are studying a third dose. So to offer a third dose, considering that many did not receive a second dose, is an ethics debate that has to be carried out. We also have been having issues with people choosing the vaccine that they want to receive.
Na realidade, o Ministério da Saúde tem o compromisso de prover vacinas com equidade para todos os estados.
The Ministry of Health is committed to offering vaccines to all the population. And we are trying to do the vaccination in a just and quick way.
Especialistas às vezes querem usar a opinião do especialista para tomada de decisão quando ele é favorável. Então, tem um cenário multifacetado, desafio.
So we have a very challenging scenario right now. I was confided with this mission by President Bolsonaro, and we will try to work together in an efficient manner to serve all the Brazilian population. Thank you.
Thank you so much, Minister, Eduardo, Carlos, and congratulations to all leading stakeholders in Brazil on the launch of the Brazilian Consensus Framework. This is a fantastic achievement and ongoing progress and process that no doubt will spur further collective action in Brazil and across the Americas.